Whether this is your first time joining us or you've been exposed to Wild Good Therapy before, welcome. Today, I'm so happy to have Jordan Wilson, who's a licensed professional counselor working at LifeWorks Professional Counseling, joining us, and we're going to be talking about spravato and ketamine-assisted psychotherapy.
Yeah. Thank you. I'm happy to be here and help explain any further and what I can.
So one of the things that we talk about a lot around the office is what Wild Good Therapy is. And for us, it really is learning a lot of different things and offering different modalities, different interventions, different styles of therapy to people, because we take that part very seriously as therapists. We really need to try to figure out what our clients need and offer that to them. Now, it is a very dynamic, evolving relationship that can change within a 50-minute session or within 3 sessions. So we're always open to feedback as well. But I think one of the things in my practice, and I specifically work primarily with people who have been diagnosed with complex PTSD, is that a lot of times they don't know how to self-reference. They don't know what they need or what might be helpful for them. And that was one of the things that got me into doing ketamine-assisted psychotherapy, just as a way to help them experience themselves and maybe the material that they needed to process in a different way and get some distance from it so they could actually process through that instead of being stuck in it and being triggered all of the time whenever any of those trauma reminders came up. And I've been so grateful for Jordan. She's joined me working with a client, one of her clients who actually was willing to do ketamine-assisted psychotherapy. So it's been quite a journey with that client and with Jordan. So Jordan, I just want to invite you to share maybe some of the important things that you've experienced as part of that process.
Oh my goodness. Let me narrow down in my mind. There's so many. I think really piggybacking to go off of what you said, that idea of being stuck, that was something I keep coming with clients as well. And that inability, I think it's reminding me of Janina Fisher. She says, the ability to dispassionately observe what has happened to you and your responses to things, that's a super huge key in trauma treatment. I also work with a lot of individuals who have experienced complex trauma and are diagnosed with complex PTSD. And watching them go through the ketamine-assisted psychotherapy process is magical, honestly. But watching them be able to work more with the parts of themselves that are protective. So like personal disclosure, intellectualizers, people who tend to are really good at thinking about what has happened to them, but have difficulty actually accessing the feeling part of it. I think that's something I've been routinely seeing is ketamine-assisted psychotherapy really helps them tap into that feeling in a safe way that's not just flooding or not just exposing and re-traumatizing. And so I think the way that ketamine's able to do that artfully is really, I think, what makes it so appealing to many people.
Absolutely. And Jordan, you really hit on an important theme there, this idea that we all have defense mechanisms. And I want everyone to understand those are automatic processes. There's something that you learn to do very early on that's kept you safe. Or one of the criteria for being diagnosed with PTSD is that you avoid triggers. You avoid anything that reminds you of the trauma. So it's interesting to think about, you pick up a shield, whatever that might be or look like for you, and it's kept you safe for so long that it's so scary to put that down. And ketamine helps you just put it down for 30, 45 minutes or an hour.
Yeah, absolutely. It gives you that, like you said, that distance to look at it and not only feel like you're fighting against those those automatic defenses that you've built from a young age, but actually working with them. Figuring out what are the ways they've actually helped supported you, how they're impacting you now, and how you can work with them to maybe access more of that pain that's really underneath so that actual healing can happen.
And accessing that pain in a way that you're not flooded because of the distance, right? And one of the ways that we do ketamine-assisted psychotherapy here is that your therapist is with you in the session. And Jordan is actually signed up to offer ketamine-assisted psychotherapy. So she is available and open to work with people who are curious and interested if that might be something that would help with them. But one of the other things we do, I think, that makes us unique is we really are so focused on connection and the relationship. So with Jordan's client, it would have been easy enough for her to transfer that client to me to just do ketamine-assisted psychotherapy. But that client has a relationship with Jordan that they have both worked hard to have this this trust and reciprocity, and that client knows without a doubt that Jordan cares about them. And so if you come to see a therapist here, then your therapist is with you, with me, or with Jordan while you're doing ketamine-assisted psychotherapy. And really, that is about having a deeper experience of trust and safety in the room. I am a very experienced therapist. I'd have to count it up, but I think 16 or 17 years in the field. And I do I'm good at what I do, and I can build that connection quickly. But why wouldn't I bring somebody in who has that history and can speak to things that I might miss because I wasn't there when you were unpacking that?
Yeah. And typically, from what I've heard, observed in my own experience, people who are finding themselves considering treatment such as ketamine-assisted psychotherapy or even spravato, they know therapy. They've been in therapy. They know the rigmarole. They would be self-described as self-aware, like they can do that aspect. And so most people, when they've come to therapy, they've or when they come to CAP or Spravato, they know therapy, but not only that, they probably had a relationship with a therapist for a long time. And so they can know what that experience feels like of being safe in the room, because I can imagine with ketamine, I've been through ketamine-assisted therapy myself, to access those layers of yourself that you yourself are like avoidant of, can be so helpful to have somebody who's known you from the beginning, has seen those protectors come up, has seen what can be triggering, and also knows how to help you be in that space and isn't going to judge you, isn't going to shame you, isn't going to be scared of what comes up, is there as another supporting guide with you on the journey. And I think that personal connection is really what makes ketamine-assisted psychotherapy, particularly at LifeWorks, so special and magical.
Yeah, and Jordan, I love having conversations with you because you pull in so many elements. Yeah. That's a gift that you bring to all of us and your clients.
Thank you.
And thank you. And the idea of this, you've been in therapy for a long time, or you have a treatment, what we would diagnose as treatment-resistant anxiety or treatment-resistant depression. And so many times if you hit that wall and you've been trying to find a therapist that you click with, at some point it's easy to internalize that and say, there's something wrong with me. I'm not going to get this therapy thing. Why can't I do it right and feel better? Understandable. However, being able to share that with a therapist who can track your progress. I was just thinking about that this morning, the idea of a lot of times people that have been through that and they've tried multiple therapists, they've tried different interventions or different modalities. Like we will have people call and say, I want CBT therapy, or I want AEDP, or EFT. Those are, you know what you want and you're going to try something new. But this idea of really connecting with a therapist who is well-versed in many of those modalities, and can pull from all of them and help support a container where you understand this is not something that you've done wrong or something that there's a deficit for you. This is treatment that has failed you. And Jordan mentioned Spravato, and our clinic just actually became a Spravato provider. And we'll talk later about the differences between ketamine and Spravato proper. But this idea of you didn't fail. Nothing you did got you to this place where whatever that wasn't working for you. You tried out different things, and now maybe you're ready to try something else. And that could be a new therapist. That could be a new treatment modality. And when we're talking about treatment-resistant depression, we're talking about you've tried medication trials. You've tried talk therapy. Maybe you've tried TMS. Maybe you've done ECT. But none of those have worked to reduce your symptoms to the point that you're not having depressive symptoms anymore. And that, again, is not you failing. It's a system that is not very good at identifying specifically what might be helpful for you. And so having a dynamic relationship with a therapist who's able to hold that in their head and oh, this isn't working for you, what can we do differently?
Right.
And we have those conversations very directly with clients.
Oh, absolutely.
And ask for feedback.
Yes.
Yeah.
That's so important. And I think you were describing that earlier about the fluid model. I think at LifeWorks, we are very integrative, and not just integrative in the sense of, we're pulling different modalities, but integrative with the client. This is your therapy. And especially if you've been in many places and keep hitting that wall, we're here to work with you and to figure out what might work best for you. So it's very much tailor fit almost. Yeah.
Yeah, I think I know how much you think about your clients outside a session. And when you just pop in my office and process, hey, I feel kind of stuck with this, or this is what I tried.
Yeah.
I'm always amazed that you're so creative with the interventions that you can pull out and help a client experience that material in a different way.
Yeah. And I think, it's reminding me of our supervision that we were having earlier, that idea of being able to meet those needs that a client presents with that they didn't get in childhood. Did you have someone in your life who was willing to try different things to meet you with where you were struggling with? That wasn't you being difficult. That was you having a hard time and not knowing how to process this. And was any adult willing to try something different to help you help yourself? And unfortunately, for a lot, the answer is no. And at least a lot of people who come here, the answer is no. And so it's always a pleasure for me to be able to be on that journey with a client, for better or for worse.
Yeah. So Jordan and I have spent some time talking about personal experience and the ways that we've learned to navigate things. And in one of our conversations, I did a little self-disclosure where I talked about the fact that, sometimes CBT doesn't work for people. It is evidence-based, and there's a lot of research that shows that it can be helpful. But part of what we're talking about with ketamine, CBT is identifying a negative thought and then either changing that thought or changing your behaviors around it. And then that can have a significant impact on your emotions associated with that. And one of the things that I grew up hearing a lot was that my mother hated me and wished I'd never been born. So that thought in my head of I'm not worth anything, I can talk about that all day. And as you were talking about before, intellectualizing. Yeah. I know that that's not a healthy thought, and I can distance myself from it and not let it impact me, but it's not healing where that thought came from, right?
Yeah, it's not activating that central nervous system that actually received that at such a young, formidable age, I think is the word I'm looking for.
Yeah, you're right. And that idea of if you're up in your head thinking about it all the time and, I'm going to tell myself to think this, you're not dealing with the impact, the body impact. Sure. And whenever you start to interact with that concept, or maybe I'm trying something new, then there's this, I have a trauma response to that. I go into fight or flight. It's better to not be seen. And so ketamine really helps you, and it is an experiential therapy, and it can be overwhelming and intense. Sure. But it can also be overwhelming and intense in a very positive way to get you connected with different energies or different ways of understanding what happens so that you can actually heal from that. And I think that's another thing that when we're talking about wild good therapy, it's not that we're trying to help you manage symptoms. Now, we do some of that. We do teach you coping skills, deep breathing. Jordan is great at leading progressive muscle relaxation.
Oh, thank you.
And it's so fun to witness that in a session where a client's blood pressure and pulse rate goes down significantly after 3 minutes of hearing Jordan walk you through that. So that's going to be a part of what we do, but it doesn't get to the heart of why you still have these body-based reactions to whatever material is in your head. So ketamine really helps you to get underneath that, and then sometimes your symptoms will go away. Sure. And when we're talking about healing, we're not putting a Band-Aid on something. And we're also not pushing people to be healed or to feel better or to have this new narrative where everything is okay. We actually want to get into the muck, if you will, and stir it up, not so that you're overwhelmed, but so that we can actually start parsing things out. Sure. And looking at it in a different way. And that's where that healing comes from. That idea of you're in a safe relationship, you're feeling activated, but you have someone who's well-trained
Mm-hmm.
and can help you regulate through that.
Yeah.
And then your central nervous system is taking in a new experience of, oh, this is okay now. I don't have to be terrified when I start to think about this.
Yeah.
And that, I think, just find your therapist, right? The one who's able to help you experience that in the room.
Yeah.
And it takes a lot of courage.
Mm-hmm.
So I know I'm so grateful when my clients show up every week and we get to talk about a different aspect of that.
Oh yeah, it's such a place of honor, to be in that with clients, to keep coming to therapy. And like sometimes I have clients, whether they're in ketamine or like other modalities of talk therapy, they'll come in, they'll be like, I wasn't feeling like coming today, just because this is hard, and we have to name that. Going anytime you're putting yourself out there to try something new, to help yourself in what it is you're struggling with and healing that trauma from you, that's hard. And I'm not sure that credit's given enough for people who are willing to try that week after week or every other week.
Yeah, absolutely. Yeah. So let's kind of dig in a little bit more to ketamine and spravato, about what somebody might experience and maybe some of the differences there, just so people have some information. And of course, we have some of this on our website, and they can call us if they'd like more specific information. But Jordan, if you wouldn't mind just taking that and sharing your experience.
My experience. Well, with both, one, you could say, the sensations you would really expect with either would be dissociation or sedation. Now, I know people hear that D word, dissociation, and a lot comes with that, whether it's from the media, whether it's something you saw on TikTok, whether it's something you read about. But dissociation really just meaning that people might recognize as like zoning out, so to speak. It is that feeling distance from being present in your body, which for some of us may be something we're doing already on a day-to-day basis, but to a different extent, to the point that you might not quite feel in the room per se. And one thing I've learned about ketamine that is so specific is that whatever journey you go on in your mind, because you'll more than likely have an eye mask over you, so it'll just be you being in that space, you're going to go somewhere autobiographical. You're going to go somewhere mentally that has to do with your own life, and your body, mind, soul are coordinating to deliver a message to you of whatever it is that you need to receive. There is no priming that is attempted. We might go in with an intention of like, what are you hoping to get out of this? What are you looking for? More acceptance? Are you looking for more gratitude? Are you looking to not feel guilty all the time? Whatever it might be. But there's no priming that's attempted. Your therapist isn't necessarily being like, and how do you feel about that, right? Like in the session, it's a lot more about your experience, and you get to share as much or as little as what you would like. That is, I'm majority speaking from ketamine-assisted psychotherapy, because that's where I have most of my experience with. But I also know with spravato, you're not really having the therapist with you per se. And spravato is S-ketamine, which I think Crystal probably more efficiently than I could explain quite the differences between S-ketamine and ketamine. But nonetheless, with S-ketamine, it is through a nasal spray. You will, almost like Flonase, if you've ever had that, you will spray once, you will spray twice. And then spravato, you will go through the spravato experience. And you will be there for 2 hours under this experience. You'll be relaxing in a chair. You are welcome to do other things such as reading or whatnot, but we really don't encourage that. I would say we do encourage more to be one with yourself. If audio helps, having headphones, blocking out eyesight with an eye mask, anything that really just helps you be in the experience. But I would say that's a huge difference between ketamine and spravato. Is ketamine, your therapist is really there with you to help process. Spravato, during the experience, your therapist is not with you. There is a monitor. You are safe. However, it's not your therapist. However, you could schedule a meeting with your therapist like 1 or 2 days after. I would say those are the big differences. With spravato, it is going to be twice a week for up to 2 months or so, and then it'll be tapered off from there. With ketamine, it is recommended once a week. Question mark?
Yes, that kind of depends on how severe the symptoms are.
Sure.
And whether you've been through a round or two and you're just doing some maintenance.
Yeah. You might reach that maintenance phase of it. But with ketamine-assisted psychotherapy, you will have some sessions to prepare with your therapist. That's where you'll talk about those intentions, talk about what helps you regulate if it does get to be too much. Also knowing that you might feel something that feels a little uncomfortable, but uncomfortable doesn't mean unsafe.
Yes.
And how do we work through that in that space? And then you'll actually have the dosing session. That's where for ketamine assisted psychotherapy, you are taking a dissolvable tablet under your tongue and you're swishing it and then you're spitting it. And then the remainder of the session is about 2 to 3 hours. And that is the experience of the ketamine assisted psychotherapy. And then we will try to meet 1 to 2 days after that. And then we process the experience. You share again as much or as little as you would like to. But how are you planning on integrating what you learned through the experience into the rest of your living about daily life, per se?
And that integration piece is so important because that's where they're finding the most therapeutic benefit.
Yes.
So one of the things with ketamine and spravato is that it helps your lower brain connect with your prefrontal cortex and your frontal cortex. And that happens automatically just because of the medication. Now, if we would try to make that happen, I'm triggered right now. I'm going to make my lower brain connect to my prefrontal cortex. We can't make that happen. So the medication just gives you some additional psychopharmaceutical support.
That's a tough one.
So that happens, and then you're going to experience different things in your brain, which we would call neuroplasticity. The big part of that, though, is that needs to be reinforced. Our brain is all about conservation. We have these neural pathways, and we go there automatically without even thinking, and that's just our behavior. So we want to reinforce those new pathways. One of the ways I describe it with clients is like having, I don't know if everybody's seen the Rolodexes, I'm a little older, but you have them on your desk and all these little cards and you could spin it. That's what our brain does, whether we're depressed or anxious. It gets triggered, it's starting to spin. Everything in that connected neural network is depression or anxiety related. So it's really hard for you to experience joy, or if you are an adult survivor of childhood abuse and neglect, sometimes you block that stuff out. There were probably some positive experiences from your childhood, but in blocking it out, you don't have access to that. And again, that's an automatic process. It's not something that we necessarily have control over. But ketamine can help jump that track into something different. That's different. The different thing is what we want to reinforce. What was that like? How did that impact? What did you feel in your body? What emotions did you notice? I'm just going to go ahead and share something else from one of my ketamine experiences. I also use ketamine-assisted psychotherapy. I felt okay, and then I started to feel scared. And I was actually swishing the medication, and I looked at the therapist, I spit it out, and I said, it's about to get really intense. So I didn't want to manage the medication in my mouth. I wanted to spit it out. And the only thing I can remember about that journey is seeing myself as an infant and just really protective of that infant and going into whatever that space was to take me out. I don't remember what happened in that darkness, but then after I came out of it, just saying to myself as a baby, I'm so sorry that you had to go through that. You're not going to ever have to do that again. I probably would never have had that experience without ketamine.
No.
And it was such a body thing. I was afraid, but somehow my psyche did it.
Yeah.
And what that unlocked for me as far as self-trust and knowing that I can protect myself. Like, I don't even know how to describe that.
How do you put that to words?
Yeah. There's no way to put a value on that other than it was just life-altering. And so then when I worked with my therapist after that, just talking about that over and over, like I rescued myself.
Yeah.
Like how powerful is that? And that's what the magic, like you were talking about with ketamine. Because going into it, I don't know that I ever would have had the thought, I need to go back and rescue my inner child. I need to rescue that baby. No, but ketamine facilitated that. We've talked about this before, that ketamine is the best co-therapist because it takes you to places that you need to go, but you wouldn't know about or be able to access on your own.
And that's, I think, such the wisdom of it is it's coming from you, right? Ketamine's not going, okay, here's a treatment plan, here's all these things you need to do, here's all your homework, whatnot. Ketamine is working with your body, and it really speaks to the body and the soul. It's natural wisdom of how to heal the wound. On what some part of you knows the wound or is the wound and knows exactly what it needs to heal. And then we have all sorts of protectors so that we don't got to think about that. We don't got to remember that, you know. And it was, as you were describing, I was thinking about friends of mine who might hear what you're saying and they might be like, oh, because I know maybe some of you listening might be thinking the same thing too, of, oh, I'm going to remember something I don't want to. This isn't for me. And the point of what you were sharing is you had to have like your body remember parts of that so that you could rescue. Otherwise, you're rescuing air. Like you don't know what it is you're rescuing from. So that level of activation is totally necessary, not to re-traumatize again. That's why your therapist is there. That's why ketamine, or that's why the benefits of ketamine of having this dissociative response so it doesn't feel so flooded and overwhelming so that you can go back and rescue. You can go back and be with that wound and let that wound know what's changed since then and that it didn't deserve what happened, or they didn't deserve what happened.
Yeah. And that, I'm so glad you raised that, because that is something that people ask frequently, people that have childhood abuse and trauma. Am I going to have to remember every traumatic experience?
Yeah.
And so there wasn't necessarily one traumatic experience associated with that. So no, but it unlocked whatever needed to be unlocked.
The wound that was created from all of those experiences, whether for some, you know, might remember that's the crying child in the corner that was told, go into your room till you're smiling again. And it's being alone in the bed. It's the impact that you're going to be reconciling with. The point is not to replay all the worst memories ever in your mind. That's not the point. No. Nor do I find that that's necessarily the effect. It's like what you described. It's the impact of the effect.
Absolutely.
Yeah.
Yeah. So one of the reasons that we started exploring offering spravato is ketamine-assisted psychotherapy is expensive, and it's not necessarily covered by insurance. Now, there are going to be parts of it covered by insurance, including the intake and the integration session, because we really are working on your moderate to severe symptoms of depression and anxiety or PTSD. So that's certainly within the realm of what we do. But the ketamine dosing session, it's not necessarily covered by insurance. So there is going to be an out-of-pocket expense. And we started thinking about offering spravato because it is FDA approved for treatment-resistant depression. And we can bill your insurance for that. And it's considered more of a, even though ketamine-assisted psychotherapy requires a prescriber and it is a medical intervention, it's more of a therapeutic process because it's off-label. It's not... insurances won't cover it because it's not specifically defined as a treatment option for any of those diagnoses, but spravato is. And they have a lot of data that demonstrates the positive results of doing spravato. Either of them is going to be a huge time commitment, and you're also going to have, you can't drive after you do either, so you have to have someone that brings you to the office and takes you home. So it's a process, and it's going to take a lot of commitment from you. But I am here as a clinician who had so honored to witness multiple clients experience this, and also for myself personally, it's worth it. Especially if you've been trying all the things and you're not sure you have any hope anymore, but you just keep going because that's what you're supposed to do. Yeah,
right. And that's the biggest send off that I would give someone who's considering ketamine-assisted psychotherapy, especially at LifeWorks, is you are worth the time that it takes. You are worth taking up that space that it takes to achieve this level of self-nurture and self-healing with a trusted therapist. It's a wild journey. It's part of wild good therapy. It's a wild journey. But it's like you said, it's with a lot of payoff. And I hope my goal, obviously, I think both of us have the long-term goal that everybody would have access to this at some point. And if insurance would like to get the ball rolling on that, that would be appreciated. But until then, anyone who has the opportunity to pursue ketamine-assisted psychotherapy, highly recommend it. And spravato is also showing incredible results of like alleviating depressive symptoms. The criteria is a little bit more restrictive in the sense of has to be treatment-resistant depression, no anxiety, PTSD. Like you can have those, as co-occurring diagnoses, but that can't be like the primary focus of it. But if you have the opportunity to pursue either, highly recommend it. And LifeWorks, I think something extra special about LifeWorks is we have Miss Amber who works here, and she does such a great job of working with insurance to make sure you get either the copay or out-of-pocket costs as low as possible for you, because Spravato does have that Spravato with Me program where they can reduce the cost. Because it is a frequent amount of sessions, but if we can really get that cost down to make it as easy as possible on you, because you're already showing up. You're already having to get a chaperone. You're already doing all that hard work. So let's get the cost down as much as possible.